Hey, thanks for joining Dr. Wood and I for a chat. You're going to enjoy this one because we're talking about what to expect in labour. What goes on in that room when it's time
Mystical
for baby
room.
to come out.
What happens in labour ward stays in labour ward.
Yeah, true.
But what actually technically happens is, so there's a few stages of labour. First stage, second stage, third stage. I'll quickly just go through that and then we'll go into more detail.
Okay.
First stage is, so the definition of labour is when you're having regular contractions causing the cervix to dilate.
Right.
And so you basically have to get from a closed cervix to when your cervix is 10 centimetres.
Right.
And sometimes a bit of that will happen at home, you know, and when you get to the hospital, you might be 4 or 5 centimetres dilated. But that first stage, waiting to get dilated can be challenging.
Yes.
And so what can you do? Do things to distract you, like
go for a walk,
get in the pool, get in the shower, you know, do things like watch a movie if you can, you know, just something to distract you while your body's dilating. You know, you might need some pain relief, you might not. It's very individual.
Okay.
But that first stage...
Should you be in hospital? You should be in hospital at this time, or...?
Oh, when your contractions are like 3 or 4 minutes apart, lasting a minute, you probably should think about going to the hospital. But always call the birthing unit before you go, so they know you're coming in.
Okay.
Don't just turn up. It doesn't make the midwives very happy when that happens. Then, second stage, your cervix is fully dilated and it's battle
10
stations.
centimetres?
10
Right.
centimetres, that's a magical number, 10
Systems
centimetres.
go!
So what's going to happen then? There's kind of 2 stages. One stage when the head kind of needs to come down to the pelvic floor.
Yes.
And the second stage is when it comes out of the pelvic floor, right? It's kind of like this passive and active stage. And sometimes you don't really feel like you need to push straight away, and sometimes you do. And the body has this incredible way of helping you push because it feels like you need to do a poo.
Yeah, it does.
Right?
It does.
And
that's the feeling. Go with it.
Yeah,
go
don't
with that
fight
feeling.
that.
Don't fight that.
Because basically the same muscles that are used to push out a poo is going to be used to push out a baby.
Right.
Sometimes women do a poo.
So it's that pressure.
Yeah.
Yeah.
And sometimes people will actually open their bowels when they're actually pushing the baby out. And that's normal.
Yeah.
And don't be worried about it. We're all used to it.
Don't worry about that. They see it all the time.
Correct, you know, and the thing is, if you're one of these prudes, I don't want to do a poo, you know, like you're gonna just take trouble, right?
Yeah.
So you've got to just move on from that and let it happen.
Yeah.
So because your body, it's very clever because that overwhelming desire to sort of open your bowels is the same process as pushing the baby out, and sometimes
Actually feels really good when it comes out too.
Yeah. And sometimes for some women who are really having trouble, I make them go and sit in the toilet when they're pushing. It actually helps them get in their brain in the right spot. Actually, I can now do a poo.
Yeah, because people feel you've got to push from your abdominal and they push from their neck. Just go with it, girl.
Yeah, that's right.
Open those
basically,
bowels.
it's taking a big breath in and trying to really push out a big poo. Now, you'll be convinced you're going to do a poo.
A big baby.
Sometimes, poo baby. No, sometimes it can be overwhelmingly convincing you're going to do a poo, but you actually don't. It's just the presence of the baby there.
Yeah.
So that's the second stage. And your midwife or your obstetrician will be there guiding you and helping you. And obviously, when it's really starting to crown, they're beginning you to breathe and slowly pushing down, they'll guide you through all that.
Relax. Yeah.
It's not a very relaxing time, but it's a time when you just need to trust the people that are
Yeah.
And then the baby comes out, and usually it's all fine and squidgy and covered in goo, and they put it on your chest and you have a cuddle. And then...
That's the ideal picture. So thank you so much for that, Dr. Wood. I appreciate that. We can go on and on about the process of what happens in labour, but keep it locked for this kind of information and so much more. Mums at the table.